Did you know children of identical twins are genetically siblings and not cousins? There's your fun fact of the day. Enjoy the video. Good?
Now you're ad-libbing?
What?
Now you're ad-libbing?
Ad-libbing?
Yeah.
What's that?
Hey, it's Rob. Welcome to Axel's Garage. I'm here with Rob and Stephanie. The big dummy, yeah. You saw him earlier telling us about the twins. And we know somebody, we just figured it out. That whole twin thing.
Yeah.
The whole twin thing. It's because normal siblings, right, have they share 12.5% of their DNA, but the children of identical twins share
50%.
No, 25%. 50% is
easy.
normal, whatever it is. Something like that. Anyway, it is, what is today? What day is today? March 21st. March 21st, New York State has put the governor, the dictator, what are we going to call him? The Emperor Cuomo has instituted something called Pause. Now, did you ever hear Pause before this?
No.
Sit back.
No.
All right, so no, right? No, nobody's ever heard of this Pause. He's being questioned that he put the state on lockdown or shelter in place or stuff, and he's saying no, he didn't do that. He put the state on pause. All right, and I thought Pause would be an acronym, but I don't think it's an acronym.
It sounds like an acronym.
It should be an acronym.
It looks like an acronym
because it's in all caps. Yeah, okay, there you go. It's in all caps. So Governor Cuomo has put New York State on pause. I'm reading this directly from the New York State
coronavirus.health.newyork.gov
website. Yeah. All non-essential workers are directed to work from home. Don't comment yet. And everyone is required to maintain a 6-foot distance from others in public. All right, now just take that in. Everyone is required to maintain. Okay, so then you scroll down and it gives you the actual 10-point New York State on pause plan. All right, now before we discuss this plan, let me just say something. I am not opposed to the public at large doing their part to help contain and stop the spread of any kind of infectious disease pandemic like we're experiencing. Got that, dummy? Mm-hmm. Okay. But I am opposed to the man dictating without possibly authority what to do and what not to do. Right?
Uh-huh.
Right? Because the government doesn't control our lives. We control our own destiny, so to speak. So what's the 10-point New York State on pause plan? Because remember, he backed away from saying that it was a shelter in place. Because first everybody was saying it's a shelter in place, and he got some backlash. Now he's calling it a pause, which still is supposed to be an acronym because it's all caps.
It's all caps. It's very emphasized. Like it just looks like.
All right, so it says number 1, 10-point plan. Number 1, effective 8 p.m. Sunday, March 22nd. So tomorrow night, 8 p.m. About 24 hours from now. All non-essential businesses statewide will be closed. Non-essential.
You know that already. What are you reading?
Late to the party, lady. Yeah. Okay, so what's a non-essential business?
I have to change. I have the sweatshirt. You know, it's big and whatever. I'm just annoying.
She has no idea.
We're in the middle of a video.
Okay, so what's a non-essential business?
I feel like I know what it is.
Did you take your boob holster off? Is that what you went up to do?
No.
Oh. Bet she took a boob holster off. What do you call it? A sling? Something? Sling? Oh, never mind. Anyway, non-essential businesses. So what's it doesn't say what a non-essential business is. It might say later on. But people are... Huh?
Barbershop, tattoo parlors.
See, no. He shut them down already, and he could do that, Emperor Cuomo, Dictator Cuomo, because they're licensed by the state. So like a barbershop or a tattoo place or a nail salon.
Closed as of tonight.
Right, because they have a state license. So he's effectively saying your state license is no longer any good, and that's why I'm closing you. So all non-essential businesses. My whole thing is, I understand the reason for it. I understand that you have to take steps. But what about people that own a small mom and pop business? Let's say it's non-essential. What could a small mom and pop non-essential business?
Candy store.
A candy store. Yeah, okay. Let's go to candy store. Just a
Like
little.
a card store, candy
Oh
store.
yeah, a little tiny candy store. They sell the newspaper. They sell some candy, some cards,
Coffee.
maybe coffee, maybe cigarettes, cigars, lotto tickets. You know,
Essentials.
not really essentials to like a 78-year-old guy who's got nothing to do. But
Father.
yeah, sure, grumpy Grandpa Ray. That's an essential to him. But you know, like think about that business. All right, you're telling me I got to shut down by staying open. Am I doing anything to spread the virus? Not really. If I'm the only guy working in the store
And people choose to come in.
and people choose to come in, right? I don't know.
But
I
that one
I feel
person,
bad for
that one
guy.
person can make your day. I was talking to a guy who owns a vintage store.
Yeah.
And he stays open the whole day, makes nothing. He decides to close early, but someone comes in right before closing and makes his day.
Well,
That one person can make their day.
Yeah, it could. But the whole thing is, these little mom and pop stores, they still have insurance to pay. They still have rent to pay. They still have, even if they don't have employees, they still have expenses. And a couple of weeks in a real small family-run business, that could put them under. So, you know, does he even have the authority to tell a guy that owns a little jewelry store or a little, I don't know, a little candy store, like you said? Does the governor have that authority to tell him he can't open it? He's not licensed by the state. I don't know. Well, maybe there is a licensing for like a retail store. Maybe the state does have some kind of say over it. I don't know. But they've never gotten into that. They've never said, like in other states and other big cities, they've said if the mayor or whoever or the governor or whoever institutes this emergency plan, that gives him or her these extra authorities to do these things, A, B, C, and D. They never said that in New York. It's very, very weird how they're not saying a lot. So let's go. Number 2. Non-essential gatherings of individuals of any size for any reason. Example, parties, celebrations, or other social events are canceled or postponed at this time. So next Sunday is Grandma Fran's birthday, right? How old's Grandma Fran going to be, lady?
77.
77. Really?
We're going to have to edit this.
Uh-oh. All right, so however old she's going to be, it's Grandma Fran's birthday next Sunday. So according to Governor, Emperor, Dictator Cuomo, all right, according to him, we were going to have Grandma Fran and Grumpy Grandpa Ray come over here, and we were going to have dinner.
What?
What?
Who?
Grumpy Grandpa Ray.
That's what I was saying.
I know that. We're making fun. They're making fun. They're poking fun in a loving way
Yes.
at the grandparents. We're not making fun of anybody here. We don't need it in the comments. Anyway, so the Emperor, Michelle, said you can't have your mother over for dinner for her birthday. It says non-essential gatherings of individuals of any size for any reason, okay, are canceled. Right? Now, all right, it's a low risk. They've been in the house, right, for the most part, not exposing themselves to anyone and not getting exposed by anyone. They've been doing their social distancing part. We've been doing our social distancing part. And even Michelle this afternoon had cocktails with all her friends via FaceTime. All right, there was like 6 moms kvetching away, bitching about everything, complaining about everything,
Laughing about everything.
heckling and laughing and cackling. It gave me a little bit of a headache.
He joined in.
Anyway, yeah, I joined into because they were bad mouthing loud vehicles, Robbie.
I drive a loud vehicle. I think it's the safest vehicle on the street. It's safer than a Tesla. I made this argument to my friends. My car is safer than a Tesla.
I believe that, yes. Okay, so does the Emperor have the authority to say, if you want to have 4 people at your house or 3 people at your house, you can't? That's what he's saying. According to New York State on Pause, You can't have it. That's item 2. You can't have it. So item 3, any concentration of individuals outside their home must be limited to workers providing essential services, and social distancing should be practiced. So if you go outside your home, you have to provide an essential service, and you can't work together as a team. So if you're doing, I've seen like, public service workers like cops, right? So what they're saying is, if you, how's a cop arrest somebody and practice social distancing?
Too fucking bad.
Right? How does a cop, right, try to arrest somebody, the perp resists, and more cops come to help and practice social distancing? Okay? How does the utility worker, right, who's up there on the pole, connecting the giant power, because that's what's going on by us, they're rewiring. We have above ground here in New York, we have above ground power lines, and they are rewiring the main, like, big wires that are feeding, right? A ton of stuff, right? Everywhere we go. They're rewiring the main feeds coming from the substations through all the different neighborhoods. Like, do you see these guys? There's like 3 of them in one bucket, like working hard. Like, how do you not do that? Oh, no, I got to be 6 feet away. So you need 3 bucket trucks, but you can't be, they won't be able to do their job. So that's again, a little bit of just nonsense. In theory, it sounds great, but it's nonsense, right? Healthcare professionals. You ever see surgery, right? What is it, 1 doctor and the nurse is 6 feet away?
I watch Grey's Anatomy.
Yeah, we watch Grey's Anatomy. Maybe there it is. All right, so that's 3. Ridiculous. And can he dictate that, Dictator Cuomo? All right? When in public, individuals, feel free to chime in anytime you like, Stephanie.
Okay.
All right. When in public, individuals must practice social distancing of at least 6 feet from others. All right, must practice. So, Michelle, so if we go walk the dog,
Right.
we have to be 6 feet apart from each other, is what this says, according to Emperor Como.
That doesn't make sense. The husband and wife have to be. So
It
go
says-
sleep outside.
It says when in public, it's if we're not in public, we're okay. So we can sleep in the same bed. All right? When in public, individuals must practice social distancing. You notice it hasn't said clean your hands.
It does at the bottom.
It does?
Number
Okay.
10.
It has number 10.
Number 10. Oh,
All right.
yeah. Alcohol. Some
All right.
alcohol wipes.
So 6 feet away from each other when in public.
Okay.
All right. Now number 5. Number 5 from the
Emily,
dictator.
we're 6 feet apart from each other.
It's not effective yet.
Today we were walking.
Well,
the dog.
it starts tomorrow night at 8 p.m.
23 hours from now.
So, lady,
Alright.
you're making a racket over there. All right, so number 5. We're only up to number 5. This is ridiculous. All right. Businesses and entities that provide other essential services must implement rules that help facilitate social distancing of at least 6 feet. I don't even know what to say about this. It's just,
I wasn't listening.
you weren't listening? You're right. Businesses and entities that provide other essential services. Other from what? That's what they don't explain. They're not telling you. Other essential services. So what were the essential services that we're othering from? They didn't tell you. But these businesses must implement rules that help facilitate social distancing of at least 6 feet. So I guess,
Supermarkets?
I guess, yeah, I guess they should say something like, people that come to shop should come on solo. Or if there's 2 people coming into the store that's going to be open because they're like a hardware store that's saying is an
I was just
essential
going to say
service.
that's essential.
Right?
My
So me
friend
and you
works
go to the
at
hardware
AE's
store. Me and you go to the hardware store. We have to social distance while in the hardware store. And the hardware store has to take steps to, I guess, keep their employees and customers 6 feet
There's tape
apart.
on the floor at Walgreens to show you where
Oh,
to.
really?
Oh, for the line?
Yeah.
Okay, so there you go. Walgreens, a pharmacy,
That's crazy.
has tape on the floor so that people don't stand in line on top of each
What
other.
if you and I get something from Ace and like we both need to carry it, and it's like only 4 feet long?
Exactly. Problem.
We're screwed.
Yeah. But the whole thing is, if you don't do that, there's no penalty because I don't think there's any authority there.
No, but they're just trying to make this virus go away, so they're just kind of.
Yes, no, I'm not. You missed it. You were upstairs changing your clothes, lady. You were getting out of costume. When I prefaced this whole thing by saying I'm not opposed to taking steps to limit the spread of any kind of virus or anything like that, but it's the whole thing is it's becoming very authoritarian. Like I feel like they're just dictating and they're not giving any. They don't have the authority to do what they're doing, and I think they should explain to people. We're asking you to do this for the benefit of the public at large, instead of just like ordering people, like ordering the way they're doing it. It's because it's Emperor Cuomo. He's a dictator. Number 6, individuals should limit outdoor recreational activities to non-contact and avoid activities where they come in close contact with other people. So now they changed their tune a little bit. Should limit and avoid activities, not cease all activities, avoid activities. That's sort of a common sense one. I don't have a big problem with that one. And they weren't like drilling it into you. Back to 7, again, the same thing. They kind of backing off again. It's like they wrote this, like they wrote this, like, you got to do it. And now all of a sudden we're getting to 6 and 7. And it's like, well, you know, individuals should limit the use of public transportation, right? For freaking decades, they've been telling us to take public transportation. Now they want us to limit the use of public transportation, which I don't have a problem with.
Nowhere to go.
Because
You don't
well,
need
forget
it.
nowhere to go. Homeless people live in the subways, on the trains. So I don't take a subway anyway. I don't even go into this cesspool city unless I absolutely have to. Public transportation, I don't take buses. Should limit exposure by spacing out at least 6 feet from other riders. Yeah, right. Let's get on the subway and space out 6 feet from. You'll have 4 people on a train.
Well, now you can, because there's nobody going to work.
That you think nobody's going to work? I don't know.
Well, a lot. You saw Shuey's post. There was nobody on the railroad that last week.
True, but you also didn't Stephen have a list? Stephen, didn't you have a list of what they considered the essential services?
I sent it to you last night.
No, I'm reading what he sent me last night.
No.
There's a list floating around. We're gonna get it. That'll be
Yeah,
the
I
next
saw
video.
that.
This list of essential services has liquor stores as number
I
1.
know, that's what my mom sent it to me, and I was like, how is liquor stores an essential
I
service?
because I think it's to give.
It's like restaurants.
Make people not go crazy.
No, yeah, I think it's to give people something to do. They'd rather everybody stay drunk at home. All right, 8. Sick individuals should not leave their home unless to receive medical care. That makes sense. But yeah, it's common
like
sense,
any
right, Steve-O? But you like how they say should not. How about must not? How about here's where you should try to be a dictator, right? But no. When it comes to the most important thing, let's put it at number 8 and let's say should, right? Unless to receive medical care and only after a telehealth.
They're having like things over the phone. Nobody's going to the doctor's office. Like my mother's doctor is only seeing non-sick patients. She had a problem with her foot, so he saw her. But he's not seeing anybody with colds.
So the doctor is seeing non-sick patients, you said?
If you want to word it like that.
That's a bad way to word it, I
It's a
think.
bad way to word it.
So patients.
They're doing everything through the tele.
So the doctor is only seeing patients that have an ailment other than potential virus.
Yes.
Okay, that's a better way to say it. All right, so a telehealth visit to determine if leaving the home is in the best interest of their health.
Why do I hear him yelling from upstairs?
Because I'm making a video, lady. Little Red Riding Hood. All right. 9. Young people should also practice social distancing and avoid contact with vulnerable populations. I guess like grandma and grandpa. Right.
People who
People-
live in areas where it's most commonly.
It's like the
I
worst
don't know about
thing ever to
that.
have to
I
do
think
that.
a vulnerable population is people who are immunocompromised, right? So somebody undergoing cancer treatments, radiation, chemo, somebody who's got the HIV, the real virus, right? Immunocompromised people who are like AIDS, HIV,
Turkey? Yeah.
cancer treatments. Who else is immunocompromised? People who are naturally anemic, they're immunocompromised. Lupus, if you have lupus, you're immunocompromised. Diabetic? No, I don't think diabetics are immunocompromised.
No.
I think you're just trying to shout out medical elements to sound smart over there.
No.
Did Emily say diabetic?
A friend of mine is diabetic and she's taking every precaution to be safe.
Are diabetics immunocompromised?
Michaela diabetic.
I'm not
but
saying
she
they're
was later.
immunocompromised, but they're just,
All
I
right.
don't know.
And then finally, 10. It sort of gets like it got.
They're
10.
making it sound like that the first one's the most important, and 10's not really the most important.
10. Use precautionary sanitizer practices such as using isopropyl alcohol wipe.
Isopropyl.
Isopropyl. Now she
The
speaks.
science girl called you out.
You were in the medical field.
Isopropyl. I was in the medical field, you're right. But here, the medical student over here. Isopropyl. It's when you see it, it doesn't
barely in the
doesn't
medical
flow. Barely in the. I was a paramedic.
Yeah,
Are you kidding me?
Before you were born.
for the city.
Barely.
For the city.
Are you talking down about ambulance workers?
First responders.
She you know what? She'd probably call me an ambulance driver if I was still around. I used to hate that.
I want to be.
I don't need an
okay,
ambulance driver telling me when.
I want to. Dad, I want to be.
I was a paramedic
Okay, I want to be one.
in like when Brooklyn was still a shithole and all the hipsters hadn't moved in. That's but that's my little Red Riding Hood daughter. Saying that you weren't really in the medical field, you were only an ambulance
I
driver.
didn't say that. I said you weren't in the medical field.
All right. So anyway, they never tell you hand washing, right? Hand washing. They didn't talk about masks. They didn't talk about anything like that. They said they didn't even say this stuff. They said isopropyl alcohol wipes.
Why don't you do that?
They said use precautionary sanitizer practices such as using isopropyl alcohol wipes. All right, and that is it. All right, so this is the governor's pause program, which is a sort of a step back from the shelter in place that he originally, I think he originally said it in a press conference, saying, "Oh, we're going to shelter in place," and it went crazy because there was no policy or anything like that. And again, he's talking about it with no real
They are open.
authority. So, what's your thought? I just don't like the government coming in and not being able to establish some kind of authority to do what they're doing. It's almost like they're using fear tactics against the public. Again, I'm not a psycho who's going to say that we should all go out there and act recklessly and try not to contain this. But for the government to tell certain people that they can't walk their dog. A husband and wife, technically, according to this, a husband and wife who have low risk, low exposure risk, can't walk down the street together. That's a little odd. But yet they're saying that it's only outside the house that they can't be close together. Doesn't say they can't be close together in the house, which is completely ridiculous. So, and I've seen the dictatorships from other states, and they're a lot better than this idiot emperor dictator that we have, Cuomo. So, what are your thoughts? And we're going to look for that list. The list of essential services. All right, so while we were talking, we didn't even realize the camera turned off, and we ran out of, because I've been taping stuff all day. But what are your thoughts? I just think New York State's a little weird. They don't really tell you what the authority is in an emergency. If there's a state of emergency, what the governor's authority is. Then you have all the counties and the towns and the villages. Like, they should let us know what the authorities are, what they're allowed to shut down, what they're not allowed to shut down. But what I don't understand is, why is there a difference that I could stay at home, snuggle on the couch with my wife, we can get in bed together and go to sleep, and then wake up in the morning, have our coffee, but we're not allowed to go walk the dog together? So why is it we can't walk in public together, but we can stay in the same house together? That doesn't make a whole lot of sense to me. But there's your update from New York. It's New York City. Bless you.
Thank you.
What do you got? You feeling funny over there?
Nope.
We're gonna quarantine her for sneezing.
Just had a sneeze.
That was, you know what? That was one of the other things. if you're like a healthy person and you start like getting flu symptoms, and you can just like have the flu, like this thing could come out in you like the regular flu, which sucks. Having the flu sucks, or it could just be the regular flu. But if you can ride it out like a flu, why wouldn't you just like get in bed and ride it out like a flu? Why everybody rushing to the hospital as soon as they feel flu symptoms? I think because of the general panic from the media, I think that's what helps to overload the hospitals and the healthcare workers. You know, if you're old or young or immunocompromised, like we spoke about, that might be different. But if you're a healthy, individual, or person, I was going to say person. I didn't mean middle age. I was going to say middle aged. I don't mean middle age. I'm like, like adult. If you're a healthy adult that's not a senior or a junior.
I'm an adult.
You're an adult?
Yes.
She has her permit.
Yeah, she has a permit, so she's an adult. Yeah, well, yeah, like 16 and up, and not a senior citizen. And you could normally would ride out a flu without going to the doctor. I mean, maybe you should try riding it out for a couple of days before you rush and overload the health system. I think that's what I would do.
That's what I would do too, because they don't have enough of everything.
Right.
So
Like get in bed and ride it out. Sucks.
Robbie looks uninterested.
Huh?
Robbie.
I'm tired.
Robbie's tired? You've been laying around the house all day.
Tiring laying around the house all day.
All right. So that's what we got. That's our update from New York on the New York State Pause debacle with that's the microphone.
We're not using it.
Oh, you're right. We're not using it. That's the New York State Pause debacle. Were you doing that while we were using the microphone?
No.
Hope you enjoyed the video, and we'll be back with another one, hopefully soon. Thanks for watching.